Good morning, everybody, and welcome to Tuesday Training. I hope you're having a fantastic week. As always,
we are live from Austin, Texas, right here at Insurance Syndicate headquarters, and man, we have a great show for you.
Good morning. What is happening, everybody? Man, it's Tuesday, so y'all know what time it is. Time for a little training time, man. We got some news, and I got some Medigap training that I want to go over you guys with. Nothing massive, basically just kind of to follow up on some comments and conversation that I was having in another group regarding Medigap sales. I made a comment that I never bring up Medicare Advantage, that anybody that talks to me about Medicare, especially a turning 65 person, they're going to have to ask me about Medicare Advantage. And I want to explain myself a little bit more on that, why I do that, why it works for me, and then how I approach that sales process. So we are going to dump into that. But first, I do have some news. As always, there was some pretty big news that just dropped for the ACA marketplace. If you haven't already heard, I would bet you probably have, unless you're living under a rock, because it's already circulating all the groups. But before we jump into that, this show, as always, is brought to you by my good friend Eric Fierro over at DFY CRMs, man. Easily one of the best CRMs out there for agents in any space, insurance agents, period. Like if you look around, probably one of the most widely used platforms for insurance agents is Go High Level or High Level, depending on how you like to call it. And DFY is one of those many high level platforms that are out there. I use it because it's got all the customizations in it that I need that make my day easier. And then I can add some more. Great platform. So if you're interested in it, if you need a CRM, need to make some updates, give me a call. I'll be happy to show you what I'm doing with mine, but certainly give Eric a call. They'll give you a good demo over there. With that said, man, we do have some news. So a couple of things I want to jump into. Let's get it rolling. As always, we got a little bit of fraud. We got an El Paso doctor out there, decides he wants to make a little fraud. This one's not that bad. It's only 500,000. It's not like the millions that we see sometimes, but pretty simple. The doctor in El Paso agreed to pay almost $500,000 on Monday to settle allegations that he was paid off by a hospice center to commit healthcare fraud back in 2021. According to the U.S. Department of Justice, John Patterson has agreed to pay the United States $468,000 in change to resolve allegations that he received kickback payments from Nurse Mind Home Care to certify patients for hospice care when they were not eligible for the services, submitting false claims to federal health insurance programs. So pretty simple when they're basically sending false claims to Medicare and they're paying it. So thankfully they found him and they're going to go clean that up. Moving on to some more important stuff. Just recently, you guys may have heard that they were ending the telehealth coverage under Medicare, that you would not get telehealth anymore as of, I believe it was supposed to end March 31st, if I remember correctly. And that was based on a continuation through the pandemic, that they expanded telehealth services and expanded Medicare's coverage of telehealth services. So since the federal emergency, the pandemic is over, those expansions technically should have gone back, but they've been hanging out there. And it's had a bunch of people upset. They're like, hey, we're limiting access of care to folks by eliminating the telehealth coverage. And I can certainly understand that, because to a large degree, yeah, you are limiting access, right? If you have people that are in a very rural area and they got to drive, 2 hours to go see a doctor somewhere, telehealth is a great option for them, where they can easily tune in, talk to the doctor, figure out what's going on, and decide, do I need to come in, or is this telehealth going to work? And it's especially true for people that just need some behavioral health counseling. Telehealth services for behavioral health is an outstanding option, right? Why should you be required, in my opinion, to go sit in the same room as the therapist to talk to you? when you could have that same conversation in a telehealth environment through Zoom or whatever it might be. So that was supposed to end March 31st, but Speaker of the House, Mike Johnson, threw out a quick funding patch that extended it for 6 months. So we did not fix the payment reduction for doctors. A lot of doctors are pissed off right now because there is a cut in physician payments from Medicare. Another one. I think this is the 5th straight year that we've seen physician cuts. And you can see it listed right here, 2.83% physician payment cut. This was not part of the little patchwork that Mr. Mike Johnson did. But what he did do was, one, threw some money at it to avoid a partial government shutdown, number one, and extend the healthcare programs such as Medicare telehealth. Fairly simple. There's not a whole lot of meat in this article, to be honest with you. I'll make sure it's in the group. The main crux of it is to know that, hey, telehealth's not ending March 31st. They're going to extend it all the way to September 30th. Then we'll see, right? They have a ton of healthcare stuff that they're working on. I'm sure we will see more updates. In all honesty, there's a little bit more in this article about the fact that they didn't fix the Medicare payment cuts. All they did was add the telehealth thing. So I'll get this article in the group for you if you want to check it out a little deeper. But again, the main takeaway is number one, yes, doctors are losing money again this year. They're getting another 2.83% cut, but telehealth is not on the block just yet. They're going to keep it into September. Next one coming up, and then we'll get into some big news. This one, a little interesting. I'm not really sure what is actually going on here. But somebody found this article or found this little detail and decided to write an article on it. See, it says CMS deletes their Medicare Advantage vision statement, signaling another shift from health equity, maybe. What they are talking about here is a statement that was on the CMS website regarding the future of Medicare Advantage and what their vision for Medicare Advantage would be. That statement has been deleted, which has some people apparently scratching their head on Medicare or CMS's position on Medicare Advantage. Do they think it's continually or will continue it to be viable healthcare solution? Or are they looking maybe at shrinking it and phasing it out? Nobody knows the exact answer. I would think, based on our new administration and their love of private healthcare, their love of small business and capitalism, et cetera, that we would see Medicare Advantage get propped up a little more. I haven't seen any evidence that that's true. We'll see. There's a lot coming down the pipe. But right here, what this article is talking about, it says the Center for Medicare and Medicaid Services wiped away the agency's stated intentions for the future of Medicare Advantage, underlining new uncertainty for the future of health-related social needs, CMS Innovation Center models, and the federal health program. In mid-December, CMS announced that it was discontinuing its value-based insurance design. You guys may remember that. They were getting rid of the value-based model built into a lot of the Medicare Advantage plans that have all of the different supplemental benefits, et cetera, et cetera. One of their issues with that is that they feel like a lot of those supplemental benefits are not being used, not getting a high enough utilization rate. And if they are getting used, in some cases, they're being used, I won't say fraudulently, but maybe erroneously. If that could be, for example, for a while, you could get free golf clubs with Aetna under their deal, right? But then they were like, no, well, we can't just be giving people free golf clubs, man. There's got to be a reason that we're using that. I think it was a $1,200 reimbursement or whatever it was on their gym membership deal, their gym benefits. So some of those things. So it goes on to say here, so in mid-December, right, they announced that they're getting rid of the VBID model within or discontinuing it within the Medicare Advantage plans, and that participating organizations would no longer use a hospice benefit through Medicare Part A starting January 1. Also said that the model, which offered supplemental benefits to members with chronic conditions, is not economically viable due to increased risk score growth and Medicare Part D expenditures. Makes sense. Makes sense. And this is the part that they were talking about. Like recently or previously, as they still do, there is a frequently asked questions page on that website, on Medicare's website, which gives further explanation. It says that there's even an executive summary report to be released in early 2025. But the page included a section with the question, what is CMS's vision for the future of the MA program? That question and its previous answers were deleted. And so we don't know what CMS's vision for the future of the Medicare Advantage program are. Couldn't tell you right now. So it does raise some questions there. This article goes through some more in regards to a little bit of the IRA, the $2 drug list model, etc. But I also thought it was fairly interesting that, like, yeah, they just flat deleted that question altogether. We don't even know what our own vision is for the future of Medicare Advantage. So that creates a little uncertainty you can chew on out there. I don't know that it's necessarily a big deal, but it is kind of notable that, yeah, they got rid of that. So apparently they don't have an answer right now. We will see. So I'll get this one in the group as well. And then let's get to the big daddy. I hope you're ready. Buckle your seatbelt. So you may have seen this. It just came out yesterday. Make sure you can see this on my screen. Yes. So this is the press release from CMS.gov, right from the newsroom, dropped yesterday, late yesterday, apparently. CMS takes aim to reduce improper enrollments and promote more affordable health insurance marketplaces for millions of consumers. Wow. What are we doing? Now, before I jump into some of this, remember, when CMS, this is a proposed rule, you have the opportunity to comment on it. I would highly recommend that if you believe that there's anything in here that you don't agree with, or that you feel like is unfair to customers, unfair to agents, any of those things that I'm about to run through, I would highly recommend that you contact your state representatives and congresspeople and let them know, give them your comments. I will make sure when we go through this that you have the information you need on who to, I mean, obviously not your state rep, but I'll show you some of the comment stuff on how you can comment directly to CMS on here as well, because they give you a comment period. And I'm strong about this because this is your livelihood. And if you think they're messing with it, or they're messing with viable healthcare of consumers, you should definitely comment on it. Protect yourself, protect your client base, right? This is where we can fight, right? We can obviously work with groups like NABIP, groups like HAFA, et cetera, NAFA, right? And let them carry some of the load. But it's so easy to contact your congressman and give them your feedbacks directly to help, shape some of this stuff. So don't be afraid. But anyway, let's dive into this. I am not going to read this whole thing. I'm going to run through the bullet points. But basically, the Center for Medicare and Medicaid Services released a proposed rule to address the troubling amount of improper enrollments impacting Affordable Health Care Act health insurance marketplaces across the country. CMS 2025 Marketplace Integrity and Affordability Proposed Rule includes proposals that take critical and necessary steps to protect people from being enrolled in marketplace coverage without their knowledge or consent, promote stable and affordable health insurance markets, and ensure taxpayer dollars fund financial assistance only for the people the ACA set out to support. Over the last 4 years, access to fully subsidized premiums from the temporary increase in financial assistance enacted in 2021 and the elimination of common sense eligibility verification processes greatly increased the opportunity and incentive for improper enrollments. As a result, the number of applications submitted to healthcare.gov with information that failed to match federal data sources began increasing substantially in 2021. And by 2022, the number of applications with data matching issues rose to 6.3 million, up from 2.6 in 2020, a damn near triple. So that's just to give you an idea of where some of the issue is. And I know if you're an agent out there that works in the ACA space, if you're selling marketplace coverage, ACA plans, whatever it may be, I've heard plenty of you talk about that people are, my business is getting flipped without this person ever consenting to the flippage, right? Or that applications are just getting pushed through with, for lack of a better word, bullshit on them. So I don't work in the ACA space. I'm a Medicare geek, right? So I focus on that. I'm eagerly waiting for CMS to drop some new proposed rules on what they're going to do in the Medicare world. But this has a few people shook up in the ACA space, and I want to go through some of what this bill says. Now, in this article, which is already in the group, you can go find it in the group right now. You will also find a link to the entire proposed rule, which I'm just going to pop on screen real quick. It's 301 pages, right, from Department of Health and Human Services, Center for Medicare and Medicaid Services. You can go through this thing and check it out. If you're really smart, you can grab ChatGPT, feed it this document and tell it to explain it to you in layman's terms, right, and then have a conversation about it. That's something that I've started to do with some of these deeper legal documents, etc. But moving back over here, here's some bullet points on it that this says. I'm going to give you some more bullet points that I got out of it, but here are a few. The rule proposes changes to address improper enrollments to help people maintain continuous coverage and improve the risk pool. Right? CMS expects these proposals will provide premium relief to middle-class families who do not qualify for federal premium subsidies and reduce the burden of the ACA premium subsidy expenditures to the federal taxpayer. Major provisions of the rule include, and again, I'm going to give you some more, but these are the ones listed in this article. Number one, this is one that seems to, bug a few, and I think a lot of people actually like it. Ending the availability of the monthly special enrollment period for individuals with household incomes below the 150% poverty level. A policy that currently allows people to wait to enroll until they become sick instead of promoting continuous enrollment that fosters prevention and better health outcomes. That seems like a smart one to me. That is a big administrative workload for ACA marketplace to have to process enrollments that are constantly happening because these people basically have a continual SEP. So I've heard some agents talk about that, man. If they could get rid of the income SEP, that would be helpful. Well, there it is right there. Next bullet point, strengthening verifications by requiring all marketplaces to reinstitute pre-enrollment verifications of eligibility for SEPs and further require verifications of income when there is no tax data available for verification. Now, I know at least a little bit that there was maybe a period of time, whether it's still been happening or not, that you could definitely get people on subsidized plans without any real income verification. They are wanting to crack down on that some more. And as part of that, to protect against consumers being enrolled without their knowledge and consent, the rule proposes that when an enrollee does not proactively verify their ongoing eligibility for a fully subsidized plan, the marketplace must continue to re-enroll that individual into the same plan, but must also reduce the amount of advance payment on the premium tax credit by $5. This will require the enrollee to take an active step and pay a nominal $5 monthly premium until they confirm or update their eligibility determination, ensuring they are aware of their enrollment in the coverage. So pretty simple on that one. If people are getting a fully subsidized plan, meaning they're paying $0, when the next enrollment period comes around, if they do not proactively verify their ongoing eligibility for a fully subsidized plan, their income eligibility, and make maybe any plan changes in the process, they will automatically be re-enrolled in that plan, but with a $5 premium that they're going to have to pay until they verify their eligibility for a full subsidy. Pretty simple. In addition, to ensure consumers maintain continuous coverage into the new year, the rule proposes to shorten the annual enrollment period for individual marketplace coverage offered through the ACA marketplaces by ending it on December 15th. Currently ends on what? Is it January 15th, if I remember correctly? And it seems like it, for several years, it's been getting pushed all the way to like February 15th. Now they want to drop it on December 15th. It'll be a little closer to the Medicare annual election period, right? We get 7 weeks basically. So I'm not sure what that drops it for you. What I guess November. It's about the same. I get you about 6-8 weeks, if I remember correctly. So the proposed rule also makes strides in carrying out administrative priorities or administration priorities. CMS proposes a policy that would add sex trait modification to the list of items and services that may not be covered by as essential health benefits. That would start 2026. The proposed rule would also revert to the previous definition of lawfully present, and that excludes the deferred action for childhood arrivals, DACA recipients, for the purposes of enrolling in marketplace coverage. That one I know is a soft spot for a lot of people, because one of the things that a lot of us push on and talk about and argue about and lobby about is for access, healthcare access, right? That's one of the big points I know for certainly at NABIP. This is reducing access in a lot of ways. So if we return to that previous definition that was in effect from 2010 to 2024, that would ensure that taxpayer dollars to subsidize ACA coverage go only to lawfully present consumers who are eligible to enroll in subsidized coverage through the marketplace. Then it drops a couple of links. That's the whole rule, which I showed you earlier. I will put that in the article as well and in the comments, so you can just grab it from there if you want. And then what I would recommend doing, I mean, number one, if this affects you, if this involves you, if you're in the ACA space, number one, comment on anything that you don't like about these proposed rules that you feel like is either an overstep or whatever it might be. Make your comments on it, man. And then if you really want to learn more about it, I would take this 301-page document, either A, read it, or B, shove it into ChatGPT, let it read it for you and explain. But I'm going to go through a few extra items that weren't listed in that article that are in here. So key points, and I'm going to kind of rattle them off first because some of them are a little bit duplicative. Number one, past due premium payments. It didn't talk about that, but insurers can now require individuals to pay overdue premiums before starting new coverage. The DACA recipient eligibility, I already mentioned that one. More, this is your favorite part, more agent broker oversight. Clear standards are set for assessing non-compliance among agents, brokers, and web brokers to ensure they adhere to the regulations. So there will be some new, and I'll get into some of those a little deeper. Income verification. I talked about that a little bit already, right? It's going to strengthen the process to verify income for premium tax credits. Eligibility redetermination, same thing. They want every year that you have to redetermine your eligibility for those tax credits. Automatic re-enrollment, right? They're automatically being re-enrolled in those plans. Annual enrollment period shortened by 1 month. Instead of ending on January 15th, they want to end at December 15th. Special enrollment periods. The pre-enrollment verification will be required for special enrollment periods so that we're reducing improper enrollments. Actuarial value standards. They want revisions to the value standards for plans to ensure that they meet essential health benefit requirements. Gender affirming care coverage starting 2026. Insurers are prohibited from covering gender affirming care as essential health benefit. So what are some positive potential ramifications? Number one, financial integrity, right? This would enhance verification processes. The stricter eligibility criteria could reduce improper enrollments. Man, having trouble with that word today. And the misuse of funds, and could potentially save taxpayers around $11 billion. That sounds good. Market stability, requiring the payment of past due premiums before new coverage can be placed. That might discourage consumers from switching plans frequently, leading to a more stable marketplace. Fairly simple. Negative ramifications. Access limitations, like I already mentioned, right? Seems it's reducing access in some ways. So if you remove the DACA recipients, right, and you shorten the enrollment period, some people may have reduced access to their healthcare coverage options, of course. Coverage gaps, stricter income verification and pre-enrollment checks could lead to delays or loss of coverage for individuals that are unable to promptly provide necessary documentation. I don't know why it would be so difficult to provide documentation, but okay. So those are some of them. A little bit more, I want to dive into some expansion on the agent and broker oversight portion of this. What are they talking about? Well, number one, a standardized compliance assessment. CMS is introducing more structured criteria for evaluating whether an agent, broker, or web broker is complying with federal regulations. Clearer penalties for non-compliance. If an agent or broker is found violating regulations, such as misleading consumers, falsifying information, engaging in fraudulent enrollments, they could face sanctions, such as suspension or termination from participation in the marketplace. Transparency requirements. Agents and brokers must now clearly disclose their relationship with insurance companies, commissions received, and any potential conflicts of interest. They want increased oversight and monitoring using data analytics and consumer complaints to flag potential misconduct. Enhanced consumer protections to protect consumers from deceptive practices, such as brokers pushing certain plans that may not be in the best interest, but yield high commissions. Updated training requirements. Agents and brokers will be required to undergo additional training to ensure that they fully understand the latest marketplace regulations. Why is all of this important? Well, again, they're trying to reduce fraud. They're trying to reduce churn. They're trying to create some stability, right? So there have been cases where brokers misrepresented plan details, signed up consumers without consent, or engaged in fraudulent activity to collect commissions. Ensuring that consumers get fair treatment, a stricter oversight will help ensure that brokers are acting in consumers' best interest rather than prioritizing financial incentives. And ultimately protecting marketplace integrity. By reducing fraudulent enrollments or improper plan switching, the new rules help maintain the stability of the marketplace and prevent misuse of the financial assistance programs. So on the positive side, we're looking at more accountability, better consumer experience, and reduced fraud and waste. On the negative side, we're looking at increased administrative burden on the agent's behalf, right? Because you're going to face higher compliance costs, probably more paperwork, etc. A possible reduced availability of broker. They're kind of speculating that because of the increased administrative burden, we might lose some agents out of this. I don't know if that's necessarily true or not, but certainly could be true. Though we might see some, and maybe the agents that exit are the ones that are doing all the fraudulent bullshit in the first place. Maybe not, though, right? If there's an increased administrative burden, increased regulation on the agent, we very well may see some agents bail out of that marketplace because it's too tough for them or whatever the case may be. Maybe they feel like it's not profitable for them anymore. We'll find out. So the conclusion at the bottom here says that while oversight measures will likely improve the integrity of the insurance marketplace and protect consumers, they may also introduce challenges for brokers and possibly impact the availability of enrollment assistance. It is important to see how these new requirements are implemented and whether they strike the right balance between consumer protection and maintaining a competitive broker marketplace. So there you go. Like I said, that article is already in the group. You can go check it out. I'm going to come behind it. I'll post the link to the full proposed rule. I'll also make sure that you have, which is inside that proposed rule, as I remember correctly. Pretty sure the whole thing is in there. The information on who to contact. Yes, it is. It's all written in there on who you can send your comments to. Now, in addition to sending comments directly to Medicare, which I'm going to make sure you have, you can also contact your state representative and talk to them about it. I actually participated in that recently face-to-face. I went straight down to the Capitol, walked right into my state representative's door, didn't knock, didn't set an appointment, nothing. And I verified before I did, like, that's okay here? Y'all don't mind that? And they're like, yeah, no, go ahead. Go knock on his door, whatever. Go walk in. So I just walked right in his door, had my talking points, talked to him real quick and said, hey, these are our concerns that we're looking at and some of the hot point bills that we're looking at. So you could do the same thing with this if you're close enough to your capital city that you can do that. Alternatively, just look up your Congress people, man. That's easy to find, and find out who your state representatives are at the local and state levels, and send them a letter, professional letter, addressing your comments and what you think they should be doing. So that is that. Now, with that said, I was in one of our Facebook groups recently here. I'm not off the top of my head. I'm not sure which one. And somebody asked a question about Medigap presentations. And the question was something like, hey, for all of you guys that are selling Medicare, that are only selling Medicare supplement plans, what's your pitch? What's your presentation like? Pretty simple, basic, straightforward question. And I responded pretty simple. I'm like, well, I keep it super easy. Medigap's an 80-20 plan. Most of my customers don't want to pay 20%. So they buy a low-cost Medicare supplement plan, which in your area would be, and I threw out an average number here in Texas for a 65-year-old, about $74.88. Does that sound like the type of healthcare you want? And then, of course, I had several people come behind me and say, how come you're not mentioning Medicare Advantage in there? I'm like, well, what's to mention? You asked me about people that are selling only Medicare supplement plans. If I want to only sell Medicare supplement plans, why would I introduce a different product in that conversation? I know a lot of agents feel obligated in the Medicare space. Like, well, I have to explain everything that there is about Medicare. I have to explain all the 10 different Medicare supplement plans. I have to explain all the different Medicare Advantage plans, HMOs, PPOs, HMO POS, MAPD, DSNP, CSNP, yada, yada, yada. I have to explain all of that to them. No, you don't. You're not required to. There's certainly no law. How many, if you've done AHIP before, nothing in AHIP says you have to tell them every single granular detail about, period. It doesn't say anything like that. It does say that if you're going to enroll someone in a Medicare Advantage plan or a drug plan, you have to go through the summary of benefits with them and make sure that they understand that that product is not a Medicare supplement plan. It does say you have to do that. But it doesn't say anywhere in there that when I talk to someone that's turning 65, I am absolutely 100% required to teach them the entire Medicare and You book, every possibility that they could possibly choose. So if I'm an agent and I only want to sell Medicare supplement plans, why in the world would I introduce any other product into that conversation? Number one, why would I? Like, that's the real answer. It's not I'm not saying that because I don't like Medicare Advantage plans. I'm telling you simply, I only want to sell Medicare supplements. And those are my reasonings, right? And some of that is territory-based. Geographical territory based, right? If I lived and worked with my clientele in, say, Miami-Dade County, right, or Los Angeles County, something like that, areas of New York, the Bronx, Brooklyn, whatever. Yeah, I can't run that model, right? And it wouldn't be viable. Like, if I was in Miami-Dade County, I would probably only sell Medicare Advantage plans, because the Medicare Advantage plans in Miami-Dade County are way better than the Medicare Advantage plans that are in Travis County, Texas. So yes, there are some geographical differences there, but because I'm in Travis County, Texas, and most of my clients that I personally work with are in Texas, I certainly have some in a few other states, Colorado, Illinois, Indiana, Ohio, South Carolina, North Carolina. But even in those states, I can still get away with that. I can still get away with only selling Medicare supplement plans. So to answer the first question, which is, what is your pitch if you're only selling Medicare supplement plans? Again, I'm going to tell you, keep it simple. Always use as few words as necessary to explain your point when you're selling anything, or even just talking, in my opinion. Always use as few words as possible. I get some beef from people on that. They tell me I'm a little too blunt sometimes. You ask me a yes or no question and I just answer it yes or no. They'll be like, why are you such an asshole? It's like, I'm not. I'm just giving you as few words as necessary to make sure that you understand my point of view. So same thing in sales, right? Use as few words as necessary. So when someone asks me to explain a Medicare supplement plan or whatever the case may be, I'm going to tell them it's going to be a super simple pitch. It's real easy. First, then the most important part is you need to make sure that they understand what Medicare is, exactly how it works, their little red, white, and blue card. So I tell them it's simple, man. When you get that red, white, and blue card, you got really good insurance. You can go anywhere you want in the nation and get coverage because 99% of doctors accept it, but it works like an 80-20 plan, meaning Medicare pays 80% of your bill, you're on the hook for 20%. And then I say this statement, and this is the key statement. Since most of my clients don't want to pay 20% coinsurance when they're hospitalized, they purchase a low-cost Medicare supplement plan, which reduces it down to a $257 deductible. I can do that for you for $74.88 or whatever the going rate is in your area. And then I ask them one question. Does that sound like the type of healthcare plan that you want? And then I shut up. That's it. I'm going to say it one more time. That little red, white, and blue card that you get from Medicare is really good health insurance because it allows you to go visit any doctor that you want in the nation, all 50 states, including Puerto Rico. 99% of doctors accept it. So you won't have any problems there, but it comes with a 20% coinsurance. Medicare is going to pay 80% of your bill. You're on the hook for 20%. Since most of my clients don't want to pay 20% when, not if, when they're hospitalized, they buy a low-cost Medicare Medigap plan, which would reduce it to a $257 deductible. Does that, and that's $74.88 for you. Does that sound like the type of healthcare plan you want? And they'll go, yes. Yeah, that sounds great. They might ask a couple of more questions. Pretty simple. I'm not explaining every damn plan to them, all 10 Medicare supplement plans. That's asinine because nobody's going to buy plan A, plan B, or plan D most of the time. It's extremely rare, right? We can talk about the isolated cases, the anecdotes, but I'm not. I'm talking about the mass group of people that are turning 65 years old. They're somewhat healthy, and they don't know squat about Medicare, right? I'm just going to teach them about the Medicare supplement plans that matter. Plan G and N, that's it. That's all. And I probably won't even teach them. I'm just going to tell them which plan I'm selling them, period. I'm the expert. I'm licensed expert. Not them. I am. They chose me for a reason because I have the expertise to tell them what to buy. Right? That's why they come to me. Now, another reason I can get away with talking to these consumers this way, right? Hey, it's an 80-20 plan. It's great, but you're on the hook for 20%. Most of my customers don't want to pay 20% when they're hospitalized. So I can reduce it to a $257 deductible with a low-cost Medigap plan. Cost you $75. Does that sound like the type of healthcare insurance you want? The reason I can do that is also because most of my clients that I'm selling, me specifically, right, are referrals from other Medicare supplement clients. So there are some other reasons behind why I can also get away. But even my other referrals outside of that, I just did a referral from, was it Ryan Gruner? Ryan Gruner referred me an agent that needed help for their dad. And I took care of him. I treated him the exact same way. I didn't tell him everything there is to know about Medicare Advantage plans. I told him this is how Medicare works. Since most of my clients don't want to pay 20%, they purchase a low-cost Medicare supplement plan. I quoted him the best rate I can get him. Does that sound like the type of healthcare? Because he's like, yeah, that sounds like exactly what I'm looking for. I don't want referrals or any of that stuff either. I want something good. And then beyond that, boom, we talked about some dental. We talked about drug plans, and I got him fixed up. Sold him a Medigap plan, a dental plan, a vision plan, and a drug plan. I have another customer that I'm working on, just waiting for her card to come back. Exact same thing. I did not mention Medicare Advantage plans at all. If someone wants me to teach them about a consumer, if a consumer comes to me to ask for help in Medicare, they are going to have to either A, bring a Medicare Advantage plan to the table that they're already enrolled in, right? Or they're going to have to ask me about Medicare Advantage. I am 100% will not bring it up to any of my referred or my prospects, period. unless they either come with one to the table that they need reviewed or they ask me about it. That is just the way I'm doing my business, right? And there's nothing wrong with that. So if you're an agent that only wants to sell Medicare supplement plans, you're going to have to start to take that attitude in some of your conversations. Why would, if I only want to sell this product, why would I ever bring this one into the conversation? All I'm doing is adding friction and reducing the chances that I can only sell this product, right? If you only want to sell Ford cars, why would you ever mention a Mercedes in the conversation? It just doesn't make any sense. So that's sales 101, the simplicity of it. Now, alternatively, I can build a case against Medicare Advantage plans pretty easy. Plenty of the stuff that I've talked about in this show over the last couple of years, there is a multitude of negative media, negative press about Medicare Advantage plans. It's so bad that it got to the point that they murdered someone over it. Let's be honest. Like, there's a ton of negative media about it. So you can use that negative media if you want as well, and use that to prop up why you believe your customers should be purchasing Medicare supplement plans. Now, again, this is geographically dependent. You're not going to be able to play this role in New York, areas of California, Massachusetts, a lot of the Eastern Seaboard, Florida, areas of Florida. You can in certain areas of Florida, but not all of them. You go to Miami-Dade, you're not going to be able to do that. You're going to have to learn how to sell the best Medicare Advantage plans, because they got Medicare Advantage plans with $300 MOOPs, 0, all across the board. So it's hard to compete with those. But if you're in Texas, you're in Kansas, you're in Missouri, you're in New Mexico, Arizona, many of these other states, Illinois, Indiana, etc., you can 100% build a practice by selling Medicare supplement plans. And it's not that difficult. You just have to come to the grips in your brain like, oh, it's simple. If I want to sell this product, I'm just not going to talk about this one. They're going to have to bring it up. Pretty simple. There's one other. I want to find some additional comments on that real quick. Bear with me. Because there was another statement that I made, and I just don't have it memorized in my brain, that got a lot of feedback, and I think it goes right hand in hand with this. So if you'll just give me a moment here. But I hope that kind of makes sense to you guys in regards to, like, why would you ever bring in or introduce a product into the conversation that you're not wanting to sell for whatever reason, right? I'm not here to get into the argument of what's better, Medicare supplement, Medicare Advantage, because again, it's geographically dependent, which I've already stated a couple of times. I am strictly just saying that if you believe in your area that Medicare supplement is the more viable product, or if you believe that you only want to build a business based on Medicare supplement plans, and I don't blame you if you do, this is the way I would go about it. And the primary thing is, I'm never going to bring up Medicare Advantage plan in the conversation, and if I want to sell a Medicare supplement, or if I believe that Medicare supplement is the more viable product. Here we go. And this is actually in the 7-figure Medicare agent group. Ton of comments on it. Give me just a moment. Here we go. Boom. So number one, hey, Medicare's an 80-20 plan, allows you to go national, right? Since most of my clients don't want to pay 20%, they buy a low-cost Medigap plan, reducing it to a $257 deductible, which would be $74.88 for you, or whatever rate it is, right? Does that sound like the type of healthcare you want? Yes, it does. I was asked, why wouldn't I bring up MA? And ultimately, again, I've already said that. Like, why would I introduce a product that I'm not trying to sell into the conversation? But I want to find. So someone asked, well, what if they ask you about Medicare Advantage? What would you say then? Right? So that was the second question that popped up. Well, if they ask you, like, how would you compare Medicare Advantage? Well, number one, I'm not going to unless they force me to. But if they bring it up, this is what I will say. Medicare Advantage is a privatized version of Medicare. Instead of Medicare handling your claims, now a private insurance company like Humana or Blue Cross, they're managing your claims. And instead of a 20% co-insurance, you're going to get bite-sized payments that you can pay as you use your plan. Maybe it's $20 here, $150 there, $1,000 here or there, depending on the type of claim. So you'll have bite-sized co-payments. Now, when those co-payments add up, they can get expensive, but thankfully all plans include an annual cap. The big trade-off is that now you're in a network-driven plan. So you have to use their doctors that they tell you to use. So ultimately, now the plan is in charge of your quality of health care. Does that sound like the type of healthcare plan you want? And I'm going to let them answer the question. Like, no. Or I might say, here's another, I'll give them that statement, right? Medicare Advantage is a privatized version of Medicare. So instead of Medicare handling your claims, a private insurance company like a Humana or Blue Cross is going to be handling that. Instead of having a 20% co-insurance, they're going to break it up into bite-sized payments that you pay the more you use your plan. It can still get expensive, but thankfully all those plans include an annual cap. The real trade-off is that now they're going to require to use a network of their doctors and hospitals. So ultimately, they are in charge of your quality of health care. Would you like me to explore some of those plans, or do you prefer choosing your own doctors? That would be another way to say it. Personally, I like the question, is that the type of healthcare that you want? I described a type of healthcare, and then I just ask them, does that sound like the type of healthcare you want? Like, yeah, that works. I would totally be in charge of, absolutely. I'm definitely in with the network-driven deal where they're all in charge of my choices. Got it. Sign me up. Right? Pretty simple. So, yes, number one, it's geographically dependent, right? You're not going to be able to just sell Medicare supplements. I mean, I guess you could. If you got really, really good at it in areas of Florida, you could definitely learn how to. But like those areas, like Miami-Dade, for example, like it doesn't make sense to sell a Medicare supplement when I can get someone on a 000 plan that has a $500 MOOP or a $300 MOOP. That's just stupid. Put them in that plan. But in other areas, especially rural areas, right, you should learn to sell Medicare supplements well, and it's not hard. Stop trying to describe all 10 plans. You only have to tell them. Unless they ask me, I don't tell them. I just tell them this is what you're getting. Medicare works like this. I plug in this solution. Does that sound like the type of healthcare you want? Yes, it does. All right, cool. Let's bang it out. Boom, boom, boom. Right? Fairly simple. That is pretty much it for the show, man. I hope that helps you guys. I hope that gives you some pointers on selling Medicare supplements a bit. If anybody has any questions on Medicare supplement sales, or if you're looking for some good products to add to your portfolio, please give me a holler. I have got some great tools over here that I'm using to write business in that $74 premium range sometimes, or whatever it might be. So if you are interested in any of that, give me a buzz. Look me up right here on Facebook anytime you want. Other than that, man, I do this show every Tuesday. I will see y'all next Tuesday live at 9 a.m. Have an awesome, awesome day.